we're going to talk next about legal and ethical aspects, because nobody wants to get your license taken away because of practicing medicine without a license. And there have been cases. There's a person I know he's a psychologist, but he's also an attorney. And he and I did a paper a few years ago, and we looked at the case law on this issue. Now, there's a number of professional folks that have been accused of practicing medicine without a license. And these include nurses, pharmacists, chiropractors, psychotherapists, okay? And there may be massage therapists, or I don't know who else, but anyway, non-medical healthcare professionals, these people were accused of practicing medicine without a license simply because they had given information about medications. Now, in every single case, they were found not guilty, and except one, which I'll talk about. Now, here's the deal. Here's what you can do. And not do. First off, we can never tell someone to stop taking the medicine, no matter what. Now, we might say that we would like to discuss the medication issue with their physician or something like that, but we can't tell them to stop, and we can't tell them to change the dose, although you can tell them, for instance, and this is going to be common. Someone comes in and they've been treated for 3 months with an antidepressant at subclinical dose. You can tell the person, if they're not responding, that the dose they're on typically is not high enough to treat depression, but you'd like to be able to talk with their physician about changing the dose. You don't tell them. You have to go through the physician. But what can you do is this: talk about treatment options and recommendations. That's informed consent. We talked about this before. You probably have a lot more time to talk about the benefits and limitations of medication than any physician is going to have in a primary care medical setting. What to expect in terms of symptomatic improvement. I think we have to be always just be honest about this. There are certain aspects of disorders that are addressed by medicine, and certain aspects that are not. Okay, so we talk about the potential benefits, but also the limitations. Time to response is very important because, as all of us know, most of these medications take weeks to work, and so we've got to really deal with that issue up front with people. Talk about side effects and talk about compliance issues. Now, in the case law, what was found in every single case is that the person was not guilty because they weren't telling them to change the dose. They were just giving them information about the medication. And by the way, I happen to believe, I've told my patients, I want you to become an expert in this. I want you to read about it and be really informed. I think you have a right to do that. It's a good thing to do. Excuse me. But in half of the cases, the judge went on to say, not only are you not guilty, but actually, in my opinion, you did exactly the right thing, and you may have been remiss if you hadn't talked about this. Now, clearly, what is part of the ethical principles for MFT and for psychologists is you need to practice in your area of competency. And so if you're a psychotherapist and you say, hey, look, I've taken a course in this, but the truth is I don't feel competent, then there's no problem about that. Everybody needs to know when to refer for an evaluation, okay? But addressing medication issues only if you feel comfortable in doing that, okay? But what you've got to do is you've got to talk about the whole range of treatment options. And the one person that got nailed was a chiropractor who only recommended an over-the-counter remedy, health food herbal remedy. You can recommend some over-the-counter products, and we'll look at the research on this later because there are several of these that actually have been shown to have efficacy. But you have to lay out the entire range of options, which would include, for depression, for instance, pharmaceutical antidepressants, okay, exercise therapy, and so on and so forth, okay.